Welcome to this video on Mastering Pediatric Leukemia. This comprehensive review is designed for exam preparation, presented by Nagesh Sir of ND Nursing Coaching. Let's begin with our first question. Which of the following is the most common form of leukemia seen in pediatric patients? The correct answer is B. Acute lymphoblastic leukemia, or ALL, accounts for approximately 75% to 80% of all childhood leukemias. It primarily affects children aged 2 to 5 years. Next question. The definitive diagnostic test for confirmation of leukemia in a pediatric patient is which of the following? The correct answer is C. Bone marrow aspiration or biopsy is the gold standard for definitive diagnosis, as it reveals more than 25% blast cells. CBC provides initial suspicion only. A child with LL is neutropenic. Which of the following activities is strictly contraindicated? The correct answer is B. Eating fresh, unpeeled fruits and vegetables is contraindicated due to the risk of bacterial and fungal contamination. A low bacterial diet is advised for neutropenic children. Tumor lysis syndrome, or TLS, is a life-threatening complication of chemotherapy. Which electrolyte finding is not associated with TLS? The correct answer is D. Hypercalcemia is not a feature of TLS. TLS causes hyperkalemia, hyperuricemia, hyperphosphatemia, and hypocalcemia due to the rapid destruction of tumor cells. What is the priority nursing diagnosis for a child newly diagnosed with acute lymphoblastic leukemia? The correct answer is B. Risk for infection. Infection is the leading cause of mortality in leukemic children because of bone marrow suppression. Preventing sepsis is the immediate priority. Which clinical manifestation is highly characteristic of childhood ALL? The correct answer is A. Bone pain and joint swelling are classic early symptoms in pediatric ALL. This is caused by the expansion of the marrow space due to the infiltration of malignant blast cells. During induction therapy for ALL, a child develops stomatitis. Which intervention is most appropriate? The correct answer is C. Rinse the mouth with normal saline or diluted bicarbonate. These rinses are gentle and non-irritating, unlike alcohol-based mouthwashes or lemon glycerin swabs, which can irritate the mucosa. Which medication is commonly used to treat hyperuricemia in tumor lysis syndrome? The correct answer is B. Allopurinol blocks the enzyme xanthine oxidase, preventing the conversion of purines to uric acid, thus preventing uric acid nephropathy in TLS. When administering chemotherapy to a child, the nurse should monitor for anaphylaxis. What is the priority immediate action? The correct answer is B. If an anaphylactic reaction is suspected, the very first step is to stop the infusion to prevent further antigen exposure. Which blood product should be administered to a patient with severe thrombocytopenia due to leukemia? The correct answer is C. Platelet concentrates are specifically indicated to prevent spontaneous bleeding when platelet counts drop below 20,000 per cubic millimeter in leukemic patients. A child receiving chemotherapy is losing hair. What is the nursing priority regarding alopecia? The correct answer is B. Alopecia is common and often reversible. Preparing the child psychologically is the nursing priority to manage distress and self-esteem. Why is it essential to use irradiated blood products for leukemic children? The correct answer is B. Irradiated blood destroys T lymphocytes. This prevents fatal graft versus host disease, which occurs when donor T cells attack an immunocompromised host. Which of the following is an early sign of DIC, or disseminated intravascular coagulation, in a leukemia patient? The correct answer is B. Petechiae and mucosal bleeding. DIC involves the consumption of clotting factors, leading to manifestations of bleeding, like petechiae and purpura. What is the CALA antigen specifically associated with in leukemia? The correct answer is B. CALA, or CD10, is found in approximately 70 to 80% of B-cell precursor ALL cases. Which phase of chemotherapy focuses on eliminating residual leukemic cells in the sanctuary sites, such as the central nervous system? The correct answer is B. Consolidation or intensification therapy targets remaining cells, including those in sanctuary sites like the CNS, often using intrathecal chemotherapy. Why are intramuscular injections contraindicated in leukemic children? The correct answer is B. Intramuscular injections carry a high risk of hematoma due to the child's thrombocytopenia, which leads to prolonged bleeding. Which classification of chemotherapy drugs acts by mimicking purines and pyrimidines? The correct answer is B. Antimetabolites such as methotrexate mimic cellular building blocks. They interfere with DNA synthesis, killing rapidly dividing cancer cells. A child has hepatosplenomegaly. This is likely due to which of the following? The correct answer is A. Extramedullary infiltration of blast cells. Leukemic cells infiltrate organs outside the bone marrow, causing enlargement of the liver and spleen. What is the nurse's role in administering vincristine, a common all drug? The correct answer is D, all of the above. Vincristine causes neurotoxicity, and nurses must monitor for peripheral neuropathy, such as foot drop and loss of deep tendon reflexes, and also for constipation. Which of the following accurately describes blast cells? The correct answer is B. Blast cells are immature, undifferentiated hematopoietic cells that accumulate in the bone marrow and prevent normal blood cell production. A leukemic child is on long-term steroid therapy. What is the nurse's priority monitoring? The correct answer is B. Blood glucose and blood pressure. Corticosteroids frequently cause hyperglycemia and hypertension, requiring diligent monitoring. Which diagnostic finding is indicative of poor prognosis in acute lymphoblastic leukemia? The correct answer is A. A high leukocyte count at diagnosis, specifically over 50,000 per cubic millimeter, is a significant adverse prognostic factor in ALL.